Okay. Welcome to the 10th anniversary celebration of SASH. I am Kim Fitzgerald, the CEO for Cathedral Square, and I want to thank you all for joining us here today to celebrate this milestone. Because of SASH, today, thousands of Vermonters are receiving services and supports in their home. We have 140 housing locations across the state where those services that are helping them transition safely home from the hospital stay, or from helping to manage their chronic conditions, or helping them reduce falls. They're really preventing and having communities of good health and social belonging. We are here today to celebrate the impact the SASH partnership has had on Vermonters, and we are lucky to have a SASH participant with us today who will give a few words. And we're also here to thank those who have played an important part in making SASH the success that it is today. I want to begin by thanking Senator Sanders, who has been a steadfast supporter of SASH and community services based for older Vermonters. We've had funding along the way, and Senator Sanders has been and continues to be a champion for SASH. He helped us initially with our funding to get extended from 3 years to 5. He's helped us to get our funding under the all-payer model, and he has helped us now working on, hopefully, an expansion of SASH for all. So thank you, Senator Sanders, for being here with us today and for being so supportive of services for older adults here in Vermont and across the nation, and especially for your support of SASH. Senator Sanders.
Well, Kim, thank you very much for those kind words, and let me thank Kim and everybody involved in the creation and in the great work that SASH does every single day. I have known Nancy Eldridge for about 120 years. Is that right, Nancy? Nancy's husband worked with me in Burlington many, many years ago, and she has done an extraordinary job. And it is interesting, and I think not surprising, that the concept of SASH, which is very practical and down to earth and cost effective, originated here in the state of Vermont. So I must say that in a dysfunctional healthcare system, where we spend far more than the people of any other country, where some 60,000 people a year die and don't get to a doctor when they should, what SASH does is try to cut through the bureaucracy and the extraordinary expenses that the system incurs. What does it mean? It means that SASH brings healthcare and services to the people, especially seniors, in an extremely and growing complicated world. You know, as Mae West said, getting old is not for sissies. And, you know, when you're 90 years old trying to fill out forms or trying to know how to maneuver the healthcare system, that ain't easy. So SASH had the brilliant idea of bringing the services to the people. What does that mean? It means that if you have a nurse that you know and trust, and you can contact that nurse when you are sick, you don't have to end up in the emergency room and spend 10 times more for health care than otherwise would be the case. It means that if you are not kind of confused about what medicine you should be taking on a Wednesday, or that maybe the medicine is not working well for you, you have somebody to turn to. If there are forms coming in and you don't know how to fill them out, you have somebody to turn to. So what SASH is doing is making the system more human. It is bringing good people in contact with people in need. It is saving taxpayers substantial sums of money. And I have been very pleased to work with SASH over the years. We are delighted to see it grow to a national concept, and we think it should be an integral part of American healthcare. And that is, seniors should have as much help coming to them rather than having to maneuver an extremely complicated system. So to Nancy and to Kim and to everybody else who has done such great work, thank you very much.
Thank you so much, Senator Sanders. Your support means the absolute world to us. We're also very happy and glad to have Congressman Welch here with us today, who's also been a huge supporter of SASH, and I know recently visited one of our SASH communities. So I'd like to welcome up Congressman Welch.
Thank you. It's Bernie. We're gonna get. We're hanging out a lot together. We're traveling around the state. It's pretty good. I see. It really is, and we're both thrilled to be here. And you know, Bernie, I was listening to you, and everything you said, I agree with. And I'm thinking about what you've been working on with Build Back Better in the infrastructure bill in your role as the chair of the budget committee, and in addition to all the things that are long overdue, investing in our families, in child care, in housing, there's an epic moment. Ever since the 1980s, the government mantra was that the market will fix things. Well, the market has worked for some. It's crushed a lot of others. And what we're on the threshold of deciding in Washington is whether we're going to have government work on behalf of people to mitigate market excess, to protect people from market overreach. And you know, it's proven in the past that when you have government on the side of everyday people, on the side of small businesses, on the side of competition, on the side of community leaders like SASH that are doing things for their community, it's better for everybody. That's the big decision we have. And it has been really tough because it's not just the programs. It's not just that we want very wealthy people like Jeff Bezos to start paying his fair share. It's about having government be on the side of everyday people and make a difference. And one of the reasons we're at this moment is because Vermonters in this room, we're always committed to figuring out practical ways to build community and help people. It's pretty simple. It's made hard if public policy doesn't reinforce it. It's made hard if public policy steers all the money to pharma companies that have completely unlimited pricing power. It's hard if we don't invest in housing. It's hard if we don't empower local community organizations. But that glimmer of hope, that commitment to building communities, that real fundamental commitment to the dignity of our neighbors, none more so than our elderly and our kids. That's what SASH did. You were like pioneers 10 years ago. It's amazing. 10 years ago, you came up with this idea. Where'd it come from? It wasn't like some market-based solution. It was like a person-based solution. These folks right here need help. We've got people who can do it. Why not do it where they live? Why not let them feel empowered? Why not allow them to be secure and then continue to be part of the community? So when I think back 10 years ago when Nancy and others, you came up with this basic concept that seems pioneering and was, but only because it was going against the tide of let the market prevail. And of course, when it's unlimited, let the market prevail, it's all about profit as opposed to all about people. So I think all of us in Vermont are so thrilled that you have proven with SASH its effectiveness. And by the way, its cost effectiveness, that point Bernie made, you know, we can shovel money into pharma and just a few bucks here and there where we do things local, low key, you know, low tech, person to person. It really, really works. And it's worked so well that around the country, others are looking to what you did here 10 years ago and saying, hey, we want our communities to be that strong too. So thank you so much for your great work and congratulations.
Thank you so much, Congressman Welch. We also have great support from Senator Leahy, and unfortunately he couldn't be here with us today, but he has been a strong supporter since day one. He also helped with our initial funding to have it extended from 3 to 5 years. He also worked on the HUD I-WISH implementation funding, which is now has funded demonstration across the nation at 8 different states. And so here today is Polly Major to say a few words on behalf of Senator Leahy. Polly.
Thank you, Kim. Senator Leahy gave me a letter to share with all of the SASH program staff to say thank you for your work. So I'm just going to read that now and leave it with Kim. Dear SASH program staff, thank you for the care and companionship you have provided Vermonters over the last 10 years through the SASH program. You have built a model of care that truly meets residents' needs. SASH coordinators are valued by all Vermonters. Thank you for your dedicated service. Marcel and I wish you the very best. Sincerely, Patrick Leahy.
Thank you, Polly. And I want to call out all of the delegation staffers because they are just so tremendously supportive. So we have Katie and Earhart here from Senator Sanders' office. We have Polly from Senator Leahy's office. And we have Tafine here from Congressman Welch's office. You guys all hear our concerns. You rise up our voices and you help us find solutions. And we just really want to thank you. We're so lucky here in the state of Vermont to have such phenomenal delegation as well as your staff. So thank you very much. We are also fortunate to have strong leadership here in the state of Vermont, the administration level. They really want to recognize SASH and make it continue to make it into the future. We've done great work so far and we have a lot more to do. I'm happy to introduce and welcome Lieutenant Governor Molly Gray, who we had the pleasure of meeting with just a few weeks ago, and it was clear that she understands the concerns facing older adults. So I want to please welcome up Lieutenant Governor.
Good afternoon. It's a real pleasure to be here today. I have the pleasure of reading a proclamation on behalf of Governor Scott and the administration, but first want to say a few words in celebration of the 10-year anniversary of SASH. Thank you, Kim. Nancy, it was really nice to meet you today. Your legacy is really remarkable. Where's Molly? There's Molly. I see so many faces that I recognize. I know that there are a lot of SASH employees who can't be here today. I just want to recognize them. This has been such an incredibly hard time for Vermonters, especially older Vermonters. And over the last several months, I've been traveling around the state, meeting directly with communities. I've had a lot of older folks come up and break down in tears with so much gratitude for the support, be it nurses coming into homes, SASH employees coming into homes, just to have that connectivity. So thank you to all your employees for providing care to family members when family oftentimes could not be there. I want to echo what Senator Sanders has said and Congressman Welch has said about the moment that Vermont is in. We obviously have incredibly good leadership in Washington that's looking out for our small rural state, but we've known for a long time that we have a demographic crisis. And now, with the pandemic, we're seeing that crisis accelerate really profoundly. We do not have enough workers. We don't have enough nurses. We don't have enough personal care attendants. We don't have enough caregivers. We don't have enough line cooks. We don't have enough lawyers. We don't have enough law enforcement officials. Maybe enough lawyers. I think Senator Sanders and my dad have something in common, and that is that there's too many lawyers. But the truth is that we have to figure out how we're going to support programs like SASH. It started as a pilot project and now can be a leader for the nation on how to care for Vermonters, but I think also care for Americans, because let's face it, Vermont can be a model for the nation. So with the funding that's coming to the state, I feel strongly, I know the legislature feels strongly, I'm certain the governor feels strongly, that this is the moment to make very, very clear and strong investments that grow our workforce, but grow our workforce in a way that really meets the unique needs of our state. So our older Vermonters, my parents, my grandfather, my aunt, folks who have lived with me in the past in our home can stay at home and age with dignity. So that's all I will say. But I will add that my office is your office. I continue to look forward to working with you day in and day out. And now I'm pleased to read a proclamation of Governor Scott. Whereas SASH, Support and Services at Home, was created in 2011 to provide a system for coordinating healthcare and support services for older Vermonters and those with disabilities. And whereas SASH works to provide older Vermonters and those with disabilities the autonomy and structure of support needed to remain at home throughout their lives. And whereas SASH relies on regional partnerships with the area agencies on aging, home health agencies, community mental health agencies, community health teams, primary care practices, hospitals, and others to provide a comprehensive system for the delivery of individualized and population-based support and programs at home. And whereas partnerships and funding from the Department of Disabilities, Aging and Independent Living, One Care Vermont, the Green Mountain Care Board, and the Vermont Department of Health have been essential to SASH's success and expansion, having currently served over 10,600 participants through Vermont. And whereas this year's SASH celebrates its 10th anniversary, commemorating its ongoing legacy of serving vulnerable Vermonters with compassion and care. Thank you.
Thank you so much, Lieutenant Governor. It is officially SASH Day from that proclamation, so thank you very much for that. It's amazing to think about the fact that we have served over 10,000 Vermonters through SASH in the past 10 years. We have 150 of those participants who've been with us all 10 years, and we have other SASH participants who've just started with us. And today, I'm especially pleased to be able to have a SASH participant who lives right here at Allard Square be able to say a few words with you today. So I'd like to introduce Penny Pero, SASH participant here at Allard Square.
I'm honored to have been asked to speak here today, especially about something that means so much to me personally every day. After living independently in my own home, an unexpected illness made it impossible to continue. I moved in with family, but in 2018, I was fortunate to move to Allard Square when it first opened. Immediately, I met our SASH coordinator and learned from many of the opportunities that they had to offer. A lot of the residents were on different levels of independence, and SASH manages to serve us all. They also help give us a sense of community. The first year, we had a Thanksgiving dinner prepared and served by Kat Patterson, Ann O'Brien, and special help from Cindy Reed. It was a great meal and a wonderful way for us to meet with all of our new neighbors. Since COVID-19, our Thanksgiving meals have been delivered to the residents. We've had 2 wellness fairs here by the UVM nursing students, and the children from Rick Marcotte School behind us came to entertain us with a wonderful concert as well. We had weekly chair yoga, now offered on Zoom, and bone builders. It's been so much fun and good for all of us. They also offer a walking group and a weekly blood pressure clinic. Personally, the most important events was the flu and COVID-19 vaccines offered here for everyone. There are many more activities available, but the bottom line, at least for me, is the kindness and caring I feel from being part of the SASH community. I often say, I don't know how they deal with us, but I'm so glad they do. Happy 10th anniversary, SASH.
Thank you so much, Penny, for sharing your story. That is the reason SASH exists, right there. So thank you. And who better to talk about the impacts that SASH has had than our Commissioner of Health? Dr. Levine is here today to talk about the impacts of SASH, and we work closely with the Vermont Department of Health through the years, and we really appreciate you being here today, Dr. Levine.
Thank you very much. Sorry I got here a little late and couldn't hear some of the other distinguished speakers that preceded me. So I'm here to talk in a more public health, population health mode, but I have to say I really come to SASH with my clinician hat on, because so much of what I did in my practice of internal medicine, which of course involves all ages, but certainly people as they age even later in life, and the reliance I had on this community really and organization and all it could provide for my patients was really paramount and continues to be paramount in my mind. But putting my new hat on, which not so new, 4.5 years later, I do want to congratulate SASH on this milestone and thank them for all of their work, particularly that which they've done with the health department on critical public health issues. From long-standing public health challenges to our most recent efforts to combat a pandemic, SASH has helped show how public health and direct care and service can intersect and work together effectively. Because ultimately, as you will hear, SASH is a population health model, which has very impactful upstream, as we say in public health, efforts. Our Division of Health Promotion and Disease Prevention has a long history of working collaboratively with SASH. They've been active and engaged partners in planning, programming, and evaluation of a variety of chronic disease program efforts. And it's really a great example of the way community transformation grants were supposed to work, to apply multiple interventions in a variety of health promotion areas to fully transform the community. Let me just name a few of those efforts. Smoke-free housing was created in many of the housing communities, with others working toward it. This was done through community input and buy-in, and tobacco treatment opportunities were made available widely in these communities. Hypertension control activities done in concert with the resident's primary care provider, one of whom was I. Nutrition offerings were strengthened in meal programs on site. Also, this included nutrition classes, community gardens, trips to tour grocery stores and learn about healthy purchasing of foods, or purchasing of healthy foods, and how to read food labels, something most in our society don't know how to do yet. Physical activity offerings were also enhanced, including Golden Zumba and line dancing, bone building classes, walking groups, staff trained in Tai Chi to offer in housing communities. We regard, by the way, Tai Chi, to call it out a little, as one of those major modalities for falls prevention in our communities. Now, when these grants ended, the work that SASH did was continued with hypertension and diabetes prevention and management. They implemented a comprehensive hypertension protocol to use at all SASH sites, including an algorithm, a blood pressure programming for residents, and blood pressure monitors in community rooms. SASH's hypertension control rate increased from 55% to 62% over the grant cycle, despite serving clients who may have been less able to manage their hypertension well. And keep in mind, nationally, we don't think even 50% of people who are being actively managed for hypertension are under control. There is now diabetes self-management programming offered statewide at SASH sites, with trained members of the workforce to lead self-management programs. And it was the first site to put on a Stanford diabetes program for Vermonters living with disabilities. SASH has also worked with us on a number of quality improvement projects, including ways to better capture information around social determinants of health so we can respond with urgency to address disparities. They've also worked with the health department and others to advance Vermont Community Health Worker Initiative. Finally, SASH is actively engaged in Alzheimer's and healthy aging work. SASH wellness nurses screen annually for dementia using the Vermont Mini-COG and share these results with primary care physicians. They're actively working to increase dementia services and improve outcomes. One thing that speaks to the value that we place in SASH, whenever we have carry forward from grants, SASH is often the first partner that we approach because we know they are effective in their work, provide service to Vermonters who are most often in need of such support. They're willing to get creative, use data from evaluation to guide their work, and to work with us to develop expanded or pilot projects that go on to be incorporated into their future work. In summary, SASH is one of our most valued partners. Thank you.
Thank you so very much, Dr. Levine. That was really impressive. We appreciate it. We really enjoy working with the Department of Health, and we love the specific areas and the focus areas that we can work on, and then seeing the results that SASH can have. It's really quite remarkable to be part of this important work. As with most things, it takes collaborative partnerships to really succeed, and that is built into the fabric of SASH. We have over 70 partnerships around the state working together for the best possible care of our participants. Here with us today, we have Monica White, the Commissioner of Department of Disabilities, Disabilities, Aging and Independent Living, it's a mouthful, Dale, and the Department of Vermont Health Access help fund the SASH infrastructure. So I'm glad to introduce Commissioner White.
Thank you very much, Kim. Good afternoon, and thank you all for the opportunity to join in this celebration today. I started working with this remarkable initiative after the SASH launch a decade ago, and I've always been appreciative of this program's innovation and steadfast dedication toward improving the lives of older Vermonters and those with disabilities. All of the partner organizations that have come together to make SASH a reality are to be lauded today. Vermont's area agencies on aging, home health agencies, designated agencies, community health teams, and of course, the Cathedral Square Corporation. Data is certainly important, but today I'd like to share a more personal story to highlight the good work of SASH. My dear great-aunt Gloria died a couple of years ago after living in the Pioneer Street Apartments SASH site in Montpelier for a number of years. Her SASH community meant so much to Aunt Gloria, bringing much enrichment and joy to her life every day, to the point my cousin chose to include mention of SASH in her obituary. An excerpt: Gloria was a beloved and dedicated member of the Montpelier SASH program offered in her apartment building. She enjoyed the independence, support, and reassurance this program provided, as well as the friends that she made along the way. She will be missed by her friends at coffee hour, as well as her cherished SASH coordinator, Jen. This is one of countless examples of how SASH has positively impacted the lives of thousands of Vermonters and their families. The power of this program to provide support and services at home in the setting of choice is something I'm very glad to be able to celebrate with all of you today. Thank you.
Thank you so much, Monica. Because of you and your staff, Vermont truly is one of the best states to grow old in. Vermont has always led the way in innovative and creative solutions, and we are extremely grateful that Dr. Craig Jones, who 10 years ago was the Blueprint for Health Director, immediately recognized the impact SASH could have on the ground where people live. Craig is now a Cathedral Square board member, and we're happy to have him here today to say a few words. Dr. Craig Jones.
Thank you, Kim. Appreciate it. I appreciate the opportunity to be here today and celebrate SASH and Nancy's role in helping build this up, along with all the other people at Cathedral Square. It's been so interesting to sit here and reflect and listen to all the comments and the things that people have observed and noticed about what SASH has done around the state. It's truly incredible, and I'll give you a little additional context. I now get to work on primary care transformation models in 26 states around the country with the Centers of Medicare and Medicaid Innovation. Every one of those models is trying in some way to build strong primary care and community linkages with primary care services to help people get what they need and live healthy lives. It's no longer just about medical care. It's about medical care and social services, support services, and people are trying to figure it out. Well, this crew figured it out 10 years ago. And it's so impressive to see how effective it is and how durable it is, sustainable it is, and the impacts that it's had. It's pretty remarkable. And I can tell you that looking as people figure out their approach to community services around the country, this really should be a very visible model. And just to give a sense of how it came about, we were working on the blueprint design, and the nature of the program, to Dr. Levine's comment, was a population health program. We didn't use those terms quite the same way back then, but it was. It was strong primary care, getting the insurers to invest in that, getting them to invest in community health teams, and then as an extension of community health teams, the SASH teams that could actually go to people's homes. It was a model. Back then, that was not something that was easily a sale to insurers to support. And we had pilots in 3 areas with the community health teams and medical homes here in Vermont, and we were getting ready to go get Medicare to try and join us, which was a big initiative. Medicare had never joined a state-led effort before. And into my office walked Nancy and a whole collection of the folks from Cathedral Square, and they had this amazing idea and pilot. And it was effectively an extension of the community health team into housing for people with some of the highest needs, most complex needs in the state. And with a lot of work, we were able to get Medicare to join that. And it was extraordinary that they would pay for that as the first time ever that Medicare had joined state-led efforts. They would go that far. And I just have to congratulate the team. It's been a remarkable success. And, you know, Molly and now Melissa, the way you all have led the program, and with Kim, you guys have built this into something that is so evidence-based, so data-driven. It can sell itself clearly on any objective evaluation, but at the same time, as was pointed out earlier, it's just human. It's just so practical and human. So congratulations, and remarkable to come back and see you all and see how this has flourished. Thank you.
Thank you so much, Craig. We are eternally grateful that you were able to embed us in the Blueprint for Health for Vermont, so thank you. Speaking of vision, and others have mentioned this a little bit already, we would not be standing here today if it weren't for Nancy Eldridge, the former CEO of Cathedral Square. Nancy has had the vision, the knowledge, and the determination to create and promote SASH. She saw the connection between health and housing, and she knew the importance of connecting them. She never lost sight of that bigger picture and motivated others to see and reach for the same goal. Nancy now owns and operates National Well Home Network, which is dedicated to promoting SASH and SASH-like models across the nation in partnership with Cathedral Square. So in recognition of Nancy's devotion, we would like to honor her today with a Lifetime Achievement Award. And so we have a plaque which reads Lifetime Achievement Award presented to Nancy Rockett Eldridge in appreciation of your passion, advocacy, and dedication in creating and advancing SASH, presented on SASH Day as proclaimed by the Governor of Vermont, November 12th, 21. Thank you so much, Nancy. We have flowers for you and a plaque. There you are. And here's some flowers for you as well.
Flowers. Thank you so much. So as the wise Molly Dugan has always said, SASH is a team sport. And so it is fantastic for us all to be together here today to celebrate the team. Joanne has taught me what live streaming means, which means thank you, that there are people from California who are watching this, Massachusetts, South Carolina, all across the country. From the get-go, SASH was about empowerment. It was about empowering people to identify what they want. We talk a lot about social determinants of health. What determine our health is what we each want ourselves. I'll never forget the day in 1999 when I started my job at Cathedral Square, and one of our oldest residents was moved to a nursing home. And I asked, why? Incontinence. Now, if incontinence is going to be the reason we all go to a nursing home, we're all in trouble. So the whole idea behind SASH was to say, give everybody a voice in their future health and design a population health approach, as Dr. Levine said. I learned about not having options and not having voice from my older sister, Beth, who has taught me that young disabled people have no choice about where they live. She was diagnosed with MS when she was 35. She had a young son. She is now in her late 60s. She's living in a nursing home in California, sharing a bedroom and a toilet with a revolving cycle of people who are often 30 or 40 years older than her. Why do we do this in this country? Those are the people that should have the most choice, the most options. We should be building housing for them that's perfectly designed for them. When we go back to the 1960s, some of us were then alive then, and we saw Medicaid and Medicare pass. Fantastic, fantastic. But what have we done since then? We've piled on, cobbled together, patched together all sorts of programs that make it extremely difficult to navigate the system. And so we all have parents, grandparents, sometimes spouses that are having a hard time navigating the system. What we must do in this country is create a sustainable, funded, scalable initiative in this country that's based on what you all have done here in Vermont. We've got Rhode Island doing SASH. We have Minnesota doing SASH. I'm working in Baltimore now, in West Baltimore area, to develop a SASH initiative. Craig, thank you for helping design the evaluation of SASH Baltimore. Hugely helpful. Kevin, we have the Baltimore Housing Authority participating in this. Thanks to you and stepping up and representing housing authorities. Los Angeles is doing SASH, California Integrated Care at Home, SITCH. And so for Los Angeles County, we'll be rolling that out hopefully in the next year or two. So huge amount of work that's going on in this country, but simply not enough in terms of the need to empower people to speak with their own voice. Thanks to Kim for celebrating 10 years. Thanks to Joanne for pulling it all together, because I know you're the one that did that. Thanks to Mimi Reardon, who was the moral compass for SASH. She's the one that kept us all together when we were fighting. And to Betsy Davis, who has been the mother of nursing and taught us so many things. I had no idea what an A1C was or anything. There are so many people that have made this possible. So let's get resources, federal government, we need resources to make this happen in other parts of the country. There's a ton of interest. We just need the resources to do it. Thanks so much.
Thank you, Nancy. Nancy is a true inspiration to all of us. She's shown us that when you believe in something, you got to go for it and bring everybody along with you. So thank you, Nancy. Similarly, Vermont has recognized that we must reform healthcare. Costs are skyrocketing, and we can no longer be paying for every single procedure, but we need to think about the whole person and the whole population, like SASH does. When negotiating with the federal government for the all-payer model, Al Gobe, Michael Costa, and Ina Backus all knew that SASH needed to be a piece of the puzzle. We want to thank all three of them. And SASH receives its funding under the all-payer model through OneCare. And so we want to thank the Agency of Human Services, the Green Mountain Care Board, and OneCare for their tremendous support. Vicki Lohner, the CEO for OneCare, couldn't be with us today, but she did send some words that she wanted me to share. So let's see, from Vicki. OneCare has appreciated the partnership with SASH throughout the years. Born partially out of the medical home concept, SASH has grown and evolved to be an essential community health provider in the Vermont landscape. Supporting older adults to thrive independently in their communities, the SASH care coordinators and wellness nurses have provided a predictable human presence to those they care for each and every day. The pandemic has and continues to challenge everyone's physical and emotional resilience. I want to personally thank all of the staff who have likely given so much of themselves to assuring those under their care are able to maintain a good quality of physical and mental well-being during such challenging times. I hope they understand and take immense pride regarding their impact on individuals and their communities. From Vicki. Thank you, Vicki. We're sorry you couldn't be here with us today, but really appreciate those words. SASH is a statewide network of not only community service providers, but also nonprofit housing providers. We have regional housing support in every county of the state. Here with us today is Kevin Lozo, the Executive Director of Rutland Housing Authority, one of our designated regional housing organizations, DROs as we like to call them. Kevin.
Thank you, Kim. Thank you so much. If you'll indulge me a quick story. I was at Hathaway Farm a few weeks back. They have a corn maze, and at the beginning of at the entrance to the corn maze, they have cutouts, which they presented as life-size cutouts of the governor and Dr. Levine as heroes in light of what's been happening over the last far too many months as it relates to the pandemic. So I had my picture taken with your cutout, and it's great fun. It's great fun. Well, if you did, then you know. Resident opportunity and self-sufficiency. And of course, HOS, Housing and Supportive Services. These are all early attempts at bringing supportive services into housing. And I'd like to say it's part of my experience and expertise that I've had the good fortune to work on all these initiatives. But I suspect it's just that I'm old and have been around for a long time. Some might say all too long, but at any rate, over 11 years ago, I got a call, and a relatively new staff member came into my office and said, "This woman, Nancy Eldridge, wants to talk to you. Shall I say you're busy?" I said, "No. You never tell Nancy Eldridge that I'm busy. You interrupt me, regardless of what I'm doing, to take Nancy's call." So Nancy laid out this program, this pilot initiative that Cathedral Square had sponsored at one of their properties, and talked a lot about the successes that Cathedral Square was seeing with that program. Talked a lot about the link between housing and health, housing as a vaccine, and how this particular program was so critical in that it was housing based, and as a result of that, the successes were linked to the fact that housers are on site. Housers are there, they're most intimately involved with their residents, and there's a significant amount of trust that develops over the years. So it was great that Nancy spoke before I did, because I don't need to tell you about how visionary, how passionate, and how convincing and persuasive she can be. So after a very short conversation, I said, "Yes, Nancy, I'll get together with you and this group of other housing providers to talk about extending this model." I want to thank you, first of all, for inviting me, because SASH has been one of the great pleasures that I've had over the years in my housing experience. I also want to go back and reflect on a few people who I will call the SASH visionaries, or the SASHettes, as I used to refer to them. Chris Hart at Brattleboro Housing Authority, Merton Bergman at Gilman Housing Trust, now Rural Edge, Eileen Peltier at Downstreet, and John Broderick, Shires Housing. A great group of people, very committed to the model, very committed to spreading SASH throughout the state, and it was just a real privilege to work with them. I want to, in closing, I just want to acknowledge Cathedral Square and their steadfast commitment to the SASH program. I suspect that there were times that the Cathedral Square Board of Directors were thinking, boy, is this the financially prudent thing to do? And they set that aside and said it may not be the most financially prudent thing to do, but it's the right thing to do. And here we are 10 years later. And thanks to that commitment and thanks to the hard work of all the folks at Cathedral Square who've demonstrated such passion and perseverance, we have a statewide model that is not only effective, but is an inspiration for other parts of the country to pursue SASH-like programs in their states. So again, I thank you all for coming, and I thank Cathedral Square for the opportunity to tag along on this journey. It's been a labor of love. So thank you all.
Thank you so much, Kevin. Kevin, we joke, has actually been the longest-standing GROW leader. He's been with us the whole time, and he's actually, we meet on it was a weekly basis. Now we're every other week. So we really appreciate your steadfast involvement.
Yes, I think some of my colleagues refer to me as the last GROW director standing.
Yes, last man standing, yes. Well, we're so thankful of that. So to pull this all off, we need phenomenal leaders, and we are blessed to have exactly that. With vision of SASH in mind, Nancy hired Molly Dugan as our first SASH director, tasked with piloting SASH at our Heidelberg location back in 2009, creating and administering the program statewide. Molly Dugan proved the concept and then expanded SASH to every county in the state. Molly has been with us the entire time. Through our ups and downs, she has always kept her optimism and her good humor. So thank you, Molly, for your unwavering leadership over the last 10 years. And there are some flowers up here for you. Molly has transitioned into a new role at Cathedral Square. So starting this past January, we were able to promote Melissa Southwick to be our new SASH director. Melissa started with the SASH administrative team 7 years ago and worked on quality assurance and on model fidelity. Melissa has dedicated her entire career to helping older adults age in place. It is not every day that you can transition this important of a role this seriously. And Melissa hit the ground running. Even in the midst of a pandemic, she is doing a fabulous job. So thank you so much, Melissa, and I know you want to say a few words.
Thank you, Kim. I'm so happy to be here today, but I do have to say I think I drew the short straw following Kevin, who is extremely engaging, so bear with me. We've heard some wonderful presenters. I often say I can listen to Nancy talk about this all day, and I will always whenever I have the opportunity. We've also heard about the strong partnerships that make up SASH and the successes our SASH participants have experienced. I'd like to take a moment to recognize another outstanding partner, the UVM Center on Aging. The UVM Center on Aging was brought into this work in the planning stages. Nancy knew they would be a fantastic partner, and she was right. Jeannie Hutchins, the executive director at the Center on Aging, has been an active participant at our SASH admin team meetings since the beginning, since before I was there. The Center on Aging has been a steadfast supporter of SASH and has provided us with various funding opportunities as well. They funded our annual SASH Fellow since 2010. The first SASH Fellow helped my predecessor and mentor, Molly Dugan, create our SASH Operations Manual and the evidence-based practice directory that we still use today. As a part of their dedication to falls prevention, They've also funded SASH staff to be trained leaders in Tai Chi, as you've already heard. These are just a few of the ways the UVM Center on Aging has supported SASH throughout the years, and we could not be more grateful. Thank you, Jeannie. Truly, none of this would be possible without our wonderful SASH staff. We have 62 SASH panels serving over 140 locations throughout Vermont, as well as panels in Rhode Island and Minnesota, each with a SASH nurse and a care coordinator. There are also SASH supervisors, implementation managers, DRO leadership, as we just heard from Kevin, team leaders, and our SASH administration team, a few of whom are here with us today. This great group of people tirelessly works every day to make this model of care a success. SASH coordinators help with everything from care coordination and discharge planning to participant education, group programming, and so much more. They are a trusted and reliable resource in their buildings and their communities. The wellness nurses provide annual health assessments, check-ins, assistance with understanding new medications or discharge instructions, chronic condition management, and other health and wellness topics, as well as transitional support and coordination. I can't thank our amazing staff for everything that you do enough. Thank you to Penny and to all of the SASH participants out there for letting us be a part of your team. You have given us the honor and privilege to join you on your journey for many years. We have celebrated your successes, and we have worked together to lessen your challenges. The fact that our time with participants is not limited provides a level of continuity of care that is truly a gift to us all. I would love nothing more than to see the SASH model of care replicated in every state throughout the country. Not only do I hope to see us continue the work that we're doing right now, but I'd also like to see us grow from the lessons that we have learned. We have learned through a pilot that embedding a mental health clinician into our SASH sites reduces the stigma around accessing mental health services, helps to improve participant outcomes, and it improves housing retention. We need to see this in all of our SASH sites. We've also learned that using technology helps overcome many of the barriers that we face in Vermont, including those due to location, distance, or weather. We're going to continue that, and we're going to grow our telehealth and virtual programming options. I'm beyond proud of what SASH has accomplished over the past 10 years, and listening to all that has been said here today, I know that our future is bright. Thank you all for joining us to celebrate.
I also want to call out Joanne Lewis. I know Nancy previously did, but Joanne is our executive assistant, and she's been with us for 9 years now. And I honestly don't know what we did before she came to Cathedral's group, but she handles all of our details and everything behind the scenes so that all of us can shine. So thank you so much. What an incredible journey these first 10 years have been. We are looking forward to many, many more. And it would take us all day to really properly thank everyone, and I won't do that. But we do have some people we do want to call out, and a few maybe a little bit already, but that's okay. We'll call them out again because they deserve it. So Dr. Mimi Reardon and Betsy Davis for their early design work, Beth Tansman and Pat Jones on the Blueprint team for their unwavering support and belief that we'll figure it out. Also, Stephanie Hartsfield is our first Director of Operations, David O'Neill and the Champlain Investment Partners for their early and continued belief in us, the Seelig and the Vermont Housing and Conservation Board for always providing early financing for us, but specifically around SASH, and also beating the drum that services plus housing is key. People's United Bank and our other funders, all of our housing partners across the state, our community service partners, our staff, our board members, and participants. Thank you, thank you, thank you. I hope you all celebrate your contributions to the success of SASH. Thank you so much and have a great day.